Hi, my name is Adriel William, and today's topic is about teamwork, cooperation, and competition. The reason I chose this topic is because a lot of schools, and I recently got an invite from USC and UOP and many other schools, they make you do activities regarding teamwork. They want to see how good are you with your emotional intelligence. Schools like Indiana had Casper tests. Schools like USC have problem-based learning. UIC has small group learning. And all of these activities are there to see how you manage yourself in a group of people and whether you will be socially acceptable to work in that place. And that's why a lot of workplaces, school make you do these activities. So in this video, I'm going to try to explain the concept of foundational teamwork. And then I will also give you some practical tips that you could utilize in your interviews at your workplace, in your group discussion that could make a more positive impact. So in order to understand emotional intelligence, it's actually your ability to adapt and survive in a team. And why do you do it? You do it because you are trying to focus a higher goal that all of the team needs to achieve. In comparison to that, people with high IQ tend to be more isolated because they are more driven with their own thoughts and they don't like to be in a team. And institutes rather prefer a person with high emotional intelligence and team management rather than a lone wolf. And there's a very wonderful saying that I read a couple of years ago from Darwin, which says, neither the strongest, neither the fastest, but only those survive who have the ability to adapt. So working in a team requires adaptability. And why do I say that? There's a wonderful theory that I read a few years ago. It says that you compete and cooperate with each other at the same time. What do I mean when we say we compete and collaborate at the same time? If you look at a football match, two teams are competing with each other, but nobody brings a hockey stick to a football match. So while you compete, you also cooperate at the same time. Even within a team of basketball players or football players, there are competition amongst the players, but all of them want to win the match. So they are competing each other and they are collaborating at the same time. And understanding this phenomena actually made my life much more easier. So the best solution to life is you never compete with somebody that you cannot collaborate or you cannot cooperate with. And you never cooperate with somebody that you cannot compete. And that's how life works. And I'm going to use the same idea to explain the life and the interviews of a dental school. So they would want you to compete in a school. Obviously, you want to get higher scores. You want to be a better dentist than the people around you. But there is some landscape, a common landscape of rules that everybody needs to follow. While competition, you don't want to go out of that landscape, that set of rules which are decided by everyone. You need to follow them. And that's what team play means. You actually work within that set of rules and compete with each other. So if you're at your school and if you're going through an interview, for example, in a problem-based learning or in a group discussion, they might make you sit down, and these are some practical tips that you could utilize. First of all, you need to understand while working in a group, what's the common goal that everybody is trying to achieve. That's very important. So if they're given you a case discussion, if they are asking for a treatment planning, if they have shown you some kind of patient case study, you need to understand that this whole group, we are united or we are cooperating to come up with the treatment plan or some kind of differential diagnosis for this disease. So that's the most common thing that you need to understand. In addition to that, you need to find out the hierarchy in that situation. What do I mean by hierarchy? Most probably there's going to be a facilitator or a professor in that group. You never poke the professor. You never go against him. You do not say anything which is against or which could actually be insulting to that individual. So he's on the top of the hierarchy in that given time for that situation. In addition to that, then you measure out the people in your group. For example, the case is regarding endodontics or orthodontics or regarding surgery. And in the group, there is somebody sitting who's a specialist in that field. For example, I'm a general dentist and that individual is an endodontist or have been an endodontist, and the case is regarding root canal. Obviously, he's going to have more specialty and more knowledge about that topic. So I will be very careful in contradicting him, and I will make sure I will let him be on the front end of the team. Why? Because he has more knowledge in it. But my approach of dealing that situation will be more wise. How come? So you let him make the bigger call. He will let you know what the biggest problem in this case is or what the treatment plan is. And you listen to him. But you come up with a creative perspective or a creative question out of that whole discussion, which shows that you have a good approach. So for schools usually require students who have a good approach. They don't want a student who is highly intellectual and doesn't want to learn, and a student who knows nothing and doesn't want to learn. You want to show that you're in between that range and you're a teachable personality. And in order to do that, make sure you know the hierarchy in the given situation, and you never poke the people who are above you. Once that's been done, one other thing that you want to show in that group is that you're presentable, you have a good approach. So in my surgery residency, one thing I learned, even if you don't know how to extract a tooth, you should know the management of dealing that patient. So even if you don't know the answer, and for school interviews, I would recommend try your best not to give a definitive diagnosis, give a differential, because you might jump into uncharted waters and it might become difficult for you to answer. So keep more like a differential diagnosis where you are open to more ideas, be flexible with it. And that's pretty much your emotional intelligence, and that's what you're showing, that I know the approach to coming to an answer. For example, I know I will take medical history first, or whether I will take dental history, and how I will approach the patient. And that's how you come up to an answer. Along with that, one thing I will highly suggest I do suggest a lot of candidates, and I will try to tell you this, that when you're in a group, find your most presentable and comfortable state of communication. What do I mean by that? That means do not try to come up with an accent or try to fake an accent which makes you uncomfortable. But also on the other spectrum, you want to try your best to be presentable. And that's the point where you find your flow, where you're not going on either extreme. And how do you find it? By practicing. And that's something a lot I've been helping the candidates to do that. And you try your best to come up with the best presentation of your existence, because schools will always pick a person who's higher in emotional intelligence, who's good in collaboration, who is competent to some extent, and who is more teachable as compared to somebody who's a 5-star student but doesn't want to listen to anybody. So that's something I've been helping a lot of candidates with, and I've been very selective in people who I'm helping with, because it requires a lot of time. But if you have any questions, you could email me, or you could message me in WhatsApp, or you could even message me on Facebook. And I hope this video helps you, and I would say best of luck, and hopefully I will see you soon in more meaningful videos. Thank you.